with the immune system, our body is really cool in the fact that it has a lot of different ways that it can defend us against disease. And these are going to be kind of broken down into specific and non-specific defenses. And this is going to protect us from a whole bunch of stuff that we encounter every single day, from the millions upon millions of bacteria, viruses, fungi, other things that could make us ill potentially. So whenever, these ways that our body has developed to protect us fails, illnesses can become life-threatening, especially those that are not maybe normally, a serious risk, but can become very life-threatening here. And so some of these patients, can be your patients whose immune systems are suppressed for whatever reason. So some of these patients might be a patient whose immune system is suppressed because of chemotherapy or radiation, age, other illnesses like HIV or AIDS, who have organ transplants. They have to take anti-rejection medication so their immune system doesn't reject the donor organ. Other medications like corticosteroids that actually suppress the immune system, the inflammatory response. So there's a lot of different things here, how they can actually happen. So our non-specific defenses are going to be things that they don't recognize what the substance is, but they know that something. Your non-specific defenses may or may not recognize that the substance is harmful, but they don't have to know exactly what it is to protect the body. So this is stuff like mechanical or chemical protections that are provided by your skin and mucosal membranes. Your nasal hairs that help trap dirt and debris and things like that. The good old boogers that you get, those are, your body's defense system working, and it's non-specific. It doesn't target out certain bacteria. It's like, I'm going to make a booger of you. It says all of it. I'm going to make a booger of you. All right, antimicrobial substances in the blood and the interstitial space, or interstitial fluid. It just makes it inhospitable to bacteria or viruses that maybe want to live there. You have natural killer cells. All right, these natural killer cells actually go in and use phagocytosis to actually kind of engulf and eat, essentially, foreign material or debris that your body doesn't recognize. We have the inflammatory response. And then, of course, we have fever. Makes us feel like crap, but it hopefully kills off bacteria and viruses. All right, so a specific resistance to a disease is called immunity. And these substances are recognized by the immune system as foreign, and they're going to provoke an immune response. These are called antigens. In most cases, these are going to be proteins. Now, the immune system is really cool. It's got like a little filing system, essentially, of anything that it's ever encountered. So once it encounters it, it sees it, it learns how it works and how the best way to kill it is, and then it's going to go file it away for a later date. So then, if it ever encounters it again, it can be like, oh wait, hold on a second, I remember this, and it'll go remember how to, what the best combination was, how to kill this particular invader or pathogen, and then it'll go start activating that system to make those specific things that worked before happen again. Now, with this is all going to take place with your lymphocytes. Okay, you've got B and T lymphocytes, and these are going to develop from your stem cells in the bone marrow. Now, your B cells are going to mature in the bone marrow, but immature T cells migrate to the thymus to become mature. And both types of these lymphocytes have surface proteins that are going to be antigen receptors. Now, like I said, during this initial response to an antigen, there's not a lot of cells that are going to have a specific specificity for the antigen. Right? The immune system results in the development of thousands of memory cells that can rapidly differentiate upon subsequent exposure to that antigen. And the way, this is kind of why that immunization, the vaccinations, works as well as your active. So one of the ways that this works is by creating these specific antibodies that have receptors that bind to specific antigens. And the way this works is kind of like a lock and a key. I can have a key, you have a key, everybody has a key, and there's one lock. Well, we got to check all the keys to see which one's going to open up that lock and activate it and make something happen. And so there's 5 main classes of antibodies, and they're also sometimes called immunoglobulins, and they each play different roles. Right, so you've got immunoglobulin A, which is located in the mucosal membranes. You've got IgD. They don't really understand exactly how it works, but it works with IgM. And you've got IgE, which is located in the skin, the lungs, the mucous membranes. And you've got your IgG, which is in the blood, the lymph, the cerebrospinal fluid, and peritoneal fluid. And then you've got IgM, which with this is located in the blood and the lymph. Now, your IgE is the one that's predominantly involved in your allergic and anaphylactic reactions, even though it comprises less than 0.1% of all antibodies. It's got a strong affinity for binding to mast cells in the tissues and the basophils circulating within the blood. So when antigen binds to IgE, it causes these mast cells and basophils to release histamine, heparin, and other chemical mediators of inflammation. Now we recognize this as swelling, edema, and starting to become hypotensive because of what these chemicals do in the body. Now normally, under normal circumstances, this inflammatory response that's produced by this histamine is going to be localized and beneficial. So the white blood cells that are coming in to save the day, the immune system's coming in to save the day, they've got to be able to get out of the blood system and into the area, the tissue, to actually start fighting the battle against the bad guys, if you will. If they couldn't get out of the bloodstream to do that, they wouldn't be doing much good. So locally this is good, but if it's happening like that all over your body, then you've got increased capillary permeability. So not only do you have that, but you also have fluid seeping out everywhere in the body. So it's going to cause that rapid drop in blood pressure. We recognize that as anaphylaxis.